Good morning and welcome to the third edition of IW Council's Hand Hygiene Summit. There is a well-loved thirsty rhyme, wash, wash, wash your hands, let the bubbles do their dance. The intention was to get hand washing message across to young children so that it becomes a lifelong habit. Unfortunately, in India, due to many reasons, the lack of proper hand hygiene, especially after the use of the toilet, leads to the spread of many infectious diseases, especially in children. IW Council has been spearheading the cause of good hand hygiene for the last 3 years, which is something that has now come into the public consciousness after battling the dreaded COVID-19 pandemic, which put the spotlight on something so basic to stop the spread of infectious diseases. As the world celebrates the Hand Hygiene Day today, we are here to once again remind everyone to make this small habit a persistent one to save yourself from common diseases. During the summit today, we will talk to experts to find out how significantly have behaviors changed to include hand washing, what are the impediments to the widespread adoption, and how we can increase awareness about this habit. On our first session today, which is on addressing the barriers of hand hygiene and promoting sustainable behavioral change, we have a host of specialists joining us to discuss this very important topic. Please welcome our set of panelists who are joining us to discuss this. Dr. Hira Lal, IAS, Additional Mission Director, National Health Mission, Government of Uttar Pradesh. Please also welcome Dr. N.V. Mazumdar, Chairman, International Academy of Environmental Sanitation and Public Health, New Delhi. Mr. V.R. Brahman, National Convener, Public Health Resource Network. Mr. Puneet Srivastava, Urban Wash Advisor, Utilities Water Aid, UK. Ms. Sheila Asoka, Principal, Government Senior Secondary School, Dhava, Jodhpur. And Mr. Gaurav Kapoor, Senior Monitoring and Evaluation Officer, Chicago. Thank you all for joining us, and we will wait for some of our other panelists to also join us, but thank you all for being here. Now, UNICEF says that about 3 billion people do not have access to soap and water at home, and over 800 million children do not have access to soap and water in the schools. And even when it comes to healthcare facilities, 32% are not equipped to practice hand hygiene at the point of care. These are quite alarming statistics. So let me start with you, Dr. Mazumdar. Where does India stand on this issue of sanitation and hand hygiene today in 2023? Okay, I think Mr. Mazumdar is not with us. So I'm going to pose this question to Mr. Raman. What is your experience like? Where do you think India now stands on the issue of hand hygiene in 2023? Mr. Raman, request you to unmute yourself, please.
Yeah, can you hear me now? Yeah.
Yes, please go ahead.
All right. So thanks for this question. And, this question of access, I think, it has something, I'm going to look at it from a political perspective, a science perspective, and also from a knowledge perspective to begin with. We need to know, we know that it is Buddha Purnima and also the birthday of Karl Marx together. So that is something, on May 5th this year, and we have the Hand Hygiene Day as well. So I was looking at, from the Buddhist understanding of hygiene, I was looking at, and other religious doctrines, how they looked at, hygiene as a subject. And on the other hand, I was also looking at Marx, who looked at an advanced, societal perspective and an economic perspective on this. So from this, I was looking at what makes us, the situation is quite clear. Situation is quite clear that a large number of people are not having access to, say the very specific products and processes and the basic know-how of why hand hygiene is important. So there are 3 things: the software and hardware. The hardware part is missing and the software part is also missing, but the hardware part is well addressed by the market. Well addressed by the market in the sense, the products are, and the market is having its own way of looking at it also. So the pity of our lives is that we are living in a market and profit driven society and economy. and it is less driven by socio-cultural, political, economic, and environmental insights. We broadly think and wish that the knowledge and science lead the society, but the reality is that the aspirations and quick fix ideals that are created by the market and profiteering society is leading us in terms of like preferences and behaviors. And also to the market gather attention and momentum from an elitist perspective, wherein a large section of society is getting excluded on its own. So that is one aspect. When you look at a market centered economy, it is quite clear that the ambassadors that they appoint, the people that they work on, all are representing a specific set of society wherein the people cannot see their ideals there, and that makes them to see isolate themselves from the process. So that is their a knowledge driven society versus a popularity driven society. The knowledge driven society is a little failing here, and the popularity and the larger popular kind of dialogues take place. So the messages of why hygiene misses out, and the hygiene processes and hygiene infrastructure takes the front seat, and the why, the reason of health, hygiene and health, that is getting the back seat. That is one thing. The second thing is about how people are living. How people are living in the sense where people are living also. So their realities. So Puneet will talk about it later, because I'm sure, because he has done a study when we were together in Water8. One thing we found was that in urban slums of Kanpur, people are spending around 900 rupees for just buying water, which they perceived as clean water. Not necessarily that is clean water, but they thought that is clean water. So if they have to 900 rupees per month for a poor family, is much more than the tariff that many urban families, elite families in the large residence welfare societies are paying as water tariff. The same thing we found in immersion research that I have done across 2 states of the country as part of the sanitation learning hub in the IDS Sussex. I'm the country representative for that, where we found that the perception of cleanliness is leading people rather than the health benefits of things. So wherein they're buying water, and since they're spending money, they want to spend it in least quantity. In that least quantity, it goes like just using water is preferred compared to using soaps and other things. And then going to women specifically, that is one very, very important and interesting factor that we were trying to understand. And women has a continuum of work at home. So whenever we stayed in some houses for doing the immersion research. So in that immersive research process, what we found was that women has a continuous work chores that they are into at their homes and at workplaces without having any adequate assistance for them. So that the multiple kind of occasions where they need to go for hand washing or hand hygiene, unless they have sufficient support and time for thinking, it's very difficult for them. So our messaging, our education, while we are picking up the popular idioms for teaching the hand hygiene and related behaviors, what is missing is the understanding of the hard reality that people are living. So in disaster prone places, people are really, really struggling. They have water around them, but they cannot use that water for cleaning and related purposes. And in urban slums where people are living, they have to struggle and quarrel with each other for getting one bucket full of water from the tanker that is supplying water to them. So the access to water as a major problem is coming as a barrier to hand hygiene. Added to, that is another important thing to tell that, when we say hygiene, it is the last letter of the WASH acronym. Why this infrastructure and service driven WASH sector had to carry hygiene, whereas the health sector was supposed to carry it. And health sector, in addition to the infrastructure and services, they have to look at the human behaviors and the societal realities and then communicate hygiene. It would have better done. But on the other hand, we also know that in 18th century, mid 18th centuries, when Ignaz Semmelweis were trying to, teach the messages of hand hygiene, it was quite, evident that the elite medical community also took time to understand that this is important. Despite they understood that this is important to practice that, even now there are several gaps. And we were thinking, many hygiene experts were thinking that the pandemic has created a important opportunity for popularizing hygiene, which is a pity that we had to wait for a pandemic. A very negative aspect of or outcome of the society to impose a good habit, which is something that we need to rethink about whether this is the way, or we need to find an alternative for understanding the difficulties and challenges that people are facing, their economic realities, their cultural realities, and then try to adopt a messaging and behavior change process for that. So India, coming back to your question, India is standing, not only India, South Asian countries and many other African countries, we have our own limitations in terms of reaching to good hygiene, whether it is hand hygiene, food hygiene, menstrual hygiene, all hygiene, but I'll focus on hand hygiene at this point. That is also, this compartmentalism is also one of the problems that we are facing. We are not able to see hygiene as a large kind of health process, but we are seeing it in compartments. That is another issue. I'll come to that sometime later. So the question, the answer is that we are, the hand hygiene practices are very poorly adopted across India, across various communities. The mothers who are working, if they are sending their children to creche or Anganwadis, there is no proper facilities and institutional arrangements for ensuring these kinds of things. Schools are not well equipped. There are not public hygiene and toilet facilities across. So there are infrastructural issues, there are service issues, and there are also behavioral issues. We need to see all these things together. Thanks.
All right. So Mr. Raman has given us an overarching view. Mr. Mazumdar, Dr. Mazumdar, thank you so much for joining us. I just wanted to ask, where India stands now, is there an improvement from a few years ago or a few decades ago? Why? One, because there is an awareness because of the COVID pandemic that we need to wash our hands. And two, there has been an improvement in the infrastructure. The government had toilet development programs, Swachh Bharat, and Har Ghar Jal as well. This is work in progress, but has there been a change on where India stands in hand hygiene today versus a few years ago? Dr. Mazumdar, you're on mute. Request you to please unmute yourself.
Yeah. Well, first of all, good morning to all of you. And it's a pleasure to be here, to be able to share my views and be educated by the learned community here. Well, that's a good question. There has been a significant difference, of course, as Mr. Raman had mentioned, that to bring or to highlight this, a pandemic had to come. So that was really, it was, after all, it was a necessity, and after all, it came. At least it came. That was very important. But if we go into the depth of this, sorry, I have a bad throat. Sorry for that. But anyway. So if we look at the different causative factors as to what was the scenario earlier and what can happen, and in future, how do we plan things? Well, if we look at the basic issues, you see, first of all, it's about sensitivity or awareness about the importance of hand hygiene, which is the most fundamental thing. This is one, which is related to education, which is related to the practices one learns from one's family right from the childhood. So this is one thing. The other thing is availability of water, which was also highlighted by my previous speaker. And the third is the availability of any detergent or soap. Now, availability of water, that's a very dire kind of situation. And you must have read about the situation in Cape Town in South Africa. So that's the kind of situation which may come. We are in Delhi, for example. Now here, we know about the groundwater, the situation of groundwater, We know about the rainfall, how much rainfall we do have. So we have a very serious situation about a sustainable supply of water. We do have the water chain, which is coming from Atnikund, and then we have the different water treatment plants and so on. But across the country, not everyone is able to get that much. And even in Delhi, if we look at different segments of society, there are people who are getting almost 400 liters per capita per day. And there are people for whom even 40 liter per capita per day is very, very difficult, even much less than that. They have to depend on tanker or some public standpost or some dirty pond. So availability of water is again a problem which actually affects across the society. And it's not only the poor, but the rich also may, not now, but in future, they may have to face this. This is the second thing. The third is about the quality of water, which should be available for washing hands. Now, the water which we use for washing hands should also be clean enough. It shouldn't be dirty water, so that the effect of washing hands should just be nullified. So it has to be clean water. Now, supply or availability of clean water is again another issue altogether, right? Then the issue of having detergent or soap or any other agent which would help in cleaning the hand better than only water. Now, hot water could be useful, but we cannot use it on our skin. So therefore, we have to, for very good cleaning, we have to use some kind of detergent or soap. Now, availability of that again is related to affordability. That is again there. But of course, 2 years before and 2 years now, there is a sea change in availability of water also, with the government's FTCH program going strong, and many families getting benefit of that. Of course, this is a large country and we are now the highest population in the world, and much more has to be done. It's not easy to cover each and everybody or each and every family, but still things are improving, and the heightened knowledge or awareness about hand hygiene, at least the people who have affordability, who don't have to face about dearth of money, at least they are much better placed. Earlier, that was also lacking. I just digress a little bit. Many people I have seen with my own eyes picking up fruit from a vendor. I just wipe it with a handkerchief and just bite on an apple. That could be risky. On the surface of the fruit, there could be contaminants, because many times fruits and vegetables are washed in unclean water and then just polished. So it could be risky. And even more, which I myself, I had a learning long back. It was 1989 when I went to China as a consultant to WHO. And the American representative there, we were having some lunch together, and he was peeling his apple. So then he said, you see, it's very risky to bite on an apple just like that, because these days there are chemicals, pesticides, which are sprayed over them, and many of them could still be active when it comes to us. So therefore, it's always better to peel it off. So that's, of course, a different level of sanitation consideration. So net, there have been increased opportunity because availability of water has improved, and because of COVID, the awareness has increased manifold. So that makes the difference. Thank you very much.
All right. Now I just want to know what it's like on the ground before I take some more macro opinion. So, Sheila ma'am, let me come to you. You're at the head of a school. Are children aware that they need to wash their hands before break time? Do teachers ensure this happens? Because what is observed, it's such a waste of time. So much time of the break goes in just washing hands. It's a huge queue. कौन करेगा? करते हैं क्या स्कूल में? मैम आपके स्कूल में होता है ये सर? Ma'am, for some reason we are unable to hear you. Could you, are you on mute? Okay, I think for some reason we're having an audio issue. Ma'am, I'll come to you again till somebody can fix your audio issue. I will ask Dr. Hira Lal. Dr. Hira Lal, अभी तक हमें एक्सपर्ट से बताया कि बहुत सारी कंसिडरेशंस होती हैं कि हैंड हाइजीन को अपनाने के लिए, एंड देयर आर इंफ्रास्ट्रक्चर इश्यूज. आपने अपने एक्सपीरियंस में क्या देखा है कोविड के बाद हेल्थ केयर फैसिलिटीज में? डॉक्टर्स, नर्सेज, जो भी हेल्थ केयर फैसिलिटीज में काम करते हैं, उन लोगों ने क्या हैंड वॉशिंग अपनी आदत बना ली है कि they will ensure that they wash their hands before they see the patients?
The answer of your question is no in single sentence. Actually, to cultivate a habit, and that is good habit. Better habit we adopt very quickly, but a good habit is not easy to adopt. So we need two things, fear or favor. Due to pandemic fear, we adopted the hand washing, and after COVID, the fear has gone, so hand washing has gone. So likewise, how to cultivate a habit in citizens, in masses, not only in the hospital officials. So we will have to convince them. Either we should create some fear like pandemic, which is not good. Creating fear psychosis to get done anything or to cultivate any good habit in anyone. I do not like this approach to get things done. So fear and favor, two words started with F. So what is favor? If we will convince by giving reasons why you should wash your hand, how it will bring benefit to you, that will be the right approach. The question is how to get it done. We have two types of community. One community that is having the required materials like water and soap both, but they are also not following the prescribed things by WHO, how to wash hand and when to wash hand. That is one category. And second category, those who are not having water and soap. So the community or the persons with required material, we need to change them so that they should start following the prescribed prescription regarding hand wash to have a good hygiene. So how to do it? In my opinion, I have done one practice in Bada, yoga mein Bada. I wanted to cultivate the habit of doing yoga in whole masses. In the population of the Bada was around 20 lakh. So how to cultivate? We started with the officials. We trained the officials, and in turn, the official started doing same thing in their home. So to inculcate the habit of proper hand washing, we should enter through two entry points. One is the school is the best entry points. If we inculcate the hello.
Sir, please go ahead.
If we enter into each and every schools of our district, we can develop this habit through students, and the students who will learn the hand washing tricks and techniques and practice in the school, we can request them that you implement this to your family members. Likewise, in offices, we can repeat this. And I have done in our project Yoga Mein Bada, and it was a huge success because there is no dearth of knowledge how to do the hand washing and when to do the hand washing. There is a ample knowledge on this, but implementation is poor because it is a social behavioral change things and it takes time. So based on my experience and yoga, we can adopt this tested tried formula to get the required type of hand washing things in our citizens.
Right. Thank you so much, Dr. Lal. It's a little of a shame that this is not being practiced so widely in healthcare facilities, especially after the pandemic came through. So, and you suggested that school is the best place to start. So let's ask Sheila ma'am. Sheila ma'am, Dr. Hira Lal कह रहे हैं कि बच्चों को सिखा दो, वो सीखेंगे, बड़ों को सिखाएंगे. तो आपके स्कूल में
आवाज आ रही है?
Yes, ma'am, we can hear you. आपसे ये पूछना है मैम, आपके स्कूल में क्या आप इंसिस्ट करते हैं बच्चे खाना खाने से पहले हाथ
मैम, मैं गवर्नमेंट स्कूल में प्रिंसिपल हूँ और अधिकतर मेरी पोस्टिंग जो है वो गवर्नमेंट स्कूल ग्रामीण एरिया में रही है मैम. तो वहां पर मैंने ये देखा कि बच्चों में जो है हैंड वॉश की प्रैक्टिस नहीं है और उस वजह से एक स्कूल में अवेयरनेस नहीं होती तो बच्चों में बीमारियों की संभावना रहती और उस वजह से क्या है मैम एब्सेंटिज्म और ड्रॉप आउट की समस्या थी. तो मैंने रिसर्च देखा घर घर जाके कि बच्चों में हाथ धोने की आदत नहीं है, इस वजह से वो अब्सेंट रहते हैं, ड्रॉप आउट हो जाते हैं. अगर उनमें अच्छी ये हैबिट आ जाए तो नियमित रूप से विद्यालय आ सकते हैं क्योंकि वो कई प्रकार की बीमारियों से बच सकते हैं. तो मैंने एक अभियान चलाया था स्वच्छ हाथ स्वच्छ शरीर अभियान और मैं जोधपुर जिले के 300 विद्यालय तक पहुंची और मैंने लगभग 30,000 बच्चों को हैंड हाइजीन की ट्रेनिंग में एम्स को जोड़कर प्रशिक्षित करा. मैम, मैंने ये देखा है कि बच्चों में जो मेन बैरियर है वो है जागरूकता का अभाव. उन्हें डेली जो है प्रेयर में जो है उनको इस प्रकार से प्रेरित करना चाहिए, उनको ट्रेनिंग देनी चाहिए. और स्कूल में हम लोगों ने लो वाटर फ्लो हैंड वॉश पॉइंट लगाए जगह जगह ताकि बच्चे खाना खाने मिड डे मील खाने से पहले हाथ धोएं. और मैंने कई ऑनलाइन और ऑफलाइन माध्यम से जिले की स्कूलों में के बच्चों को हैंड वॉश में जो है प्रशिक्षित करा. हेलो. तो मैम मेन जो मैंने देखा है कि कास्ट बैरियर, अमीरी गरीबी या किसी प्रकार का बैरियर नहीं, मेन बैरियर जो हो रहा है वो है जागरूकता का अभाव. आधारभूत सुविधाएं मायने रखती है लेकिन अब वो क्या हो रहा है मैम इतना मायने नहीं जितना कि जागरूकता का अभाव. अगर हमें अवेयरनेस एक्टिविटीज होनी चाहिए जिससे कि लोग हैंड हाइजीन से अवेयर हो जाए. और कोविड-19 ने तो सबको कह ही दिया है मैम कि उनमें आया है कि हाथों की स्वच्छता का कितना महत्व है.
ठीक है, थैंक यू शीला मैम. पुनीत सर, लेट मी कम टू यू नाउ. यू नो
मैं मोबाइल से भी कनेक्ट हुई थी.
हाँ, तो मैम मैं आपको सजेस्ट करूंगी आप अपने आप को म्यूट कर दे.
हाँ.
माय नेक्स्ट क्वेश्चन इज टू Dr. Puneet, to Mr. Puneet. Mr. Puneet, we've heard many issues being raised. शीला मैम कहती है कि मेन प्रॉब्लम अवेयरनेस की है. डॉक्टर हिरा लाल कह रहे हैं कि लोग जानते हैं पर कर नहीं रहे हैं. और मिस्टर रमन ने कहा कि बहुत सारे इश्यूज है, इंफ्रास्ट्रक्चर भी एक इशू है. तो अब हमारी ये कोशिश है कि हम सबको याद दिलाते रहें ये जरूरी है. This has to be done, and this entire summit is an effort to give a reminder to people that change your habits, but all societal change takes time. What do you think needs to be done? Because Dr. Hira also pointed out to fear and favor. Now the fear is gone. So how do you get people to get back to the habit of washing hands on a regular basis at the time it's required?
जो हैंड वॉशिंग का मुद्दा है इस पे तमाम लोगों ने अपनी बात कही. जो आपने कहा फियर और फेवर, में बिल्कुल इत्तेफाक रखता हूँ इस बात से कि फियर वाले जो चेंजेस हैं हमने डेटा वाइज देखा है ये कि ये सस्टेन नहीं करते हैं. और कोविड के पहले भी पैंडेमिक्स आए थे, एबोला आया था और बहुत सारे आए थे और ग्लोबली स्टडीज हुई हैं, और उस समय जो हैंड वॉशिंग में सर्ज देखा गया था, वो सर्ज जो है पैंडेमिक के बाद खत्म हो गया। जैसे फियर खत्म हुआ वैसे ही वो हैबिट भी खत्म हो गई, तो वो सस्टेनेबल ऑप्शन नहीं है। तो अब इशू ये है कि जो जानकारी वाली बात है, तो जानकारी मोटे तौर पे अभी मैं जहां तक देखता हूँ सभी को है कि हैंड वॉशिंग करनी चाहिए, ये एक पॉजिटिव बिहेवियर चेंज है, लेकिन फिर भी नहीं हो रहा है। आपने जो डेटा देखा अभी, आपने बताया कि भारत में 36% लोग जो है, 36% of the people in India do not wash hands with soap and water. Just wash their hand with soap and water. So rest are not doing it. So this 36% who, as per data, whatever we have, is not, I mean to say, is washing hand with soap and water. We are also not clear whether they are safely doing it or not. What Dr. Hiralal said earlier. लोग वो जो 6 स्टेप हैं, जो सेफ हैंड वॉशिंग, जो सेफ पार्ट है, और मैं ये बहुत भरोसे के साथ कहता हूं कि जितने लोग हाथ धो भी रहे हैं वो बहुत जो सेफ हैंड वॉशिंग कर रहे हैं या नहीं वो क्वेश्चनेबल है। तो जो मेन सेफ हैंड वॉशिंग का पर्पस है इन्फेक्शन प्रिवेंशन, वो जो हेल्थ वाला लिंक है वो हो भी रहा है या नहीं हो रहा है, उसकी वजह से उनमें वो क्लियर नहीं है। तो इश्यूज केवल वही नहीं है कि आप हैंड वॉशिंग कर रहे हैं या नहीं कर रहे हैं। अब जहां तक हम हैंड वॉशिंग प्रोग्राम की बात करें और प्रमोशन की बात करें, इसमें 3 चीजें निहायत ही जरूरी हैं। पहला है इंफ्रास्ट्रक्चर, जो सभी ने कहा मोर और लेस। हम लोग जब सैनिटेशन प्रोग्राम में काम करते थे तो किसी गांव में जाते थे, वहां शौचालय नहीं थे, और हम लोगों को कह रहे हैं आप शौचालय का प्रयोग करें, शौचालय का प्रयोग करें। बट इट्स रिडिकुलस, आई मीन टू से, हाउ कैन पीपल यूज शौचालय व्हेन दे डोंट हैव अ शौचालय? What this messaging means? Are we making a mockery of them? So the whole idea was that first let them have a shauchalay and then do the kind of behavior change program that actually prompts them with creating nudges, triggers, etc., incentives, जो फेवर वाली बात कही सर ने, वो सारी चीजें उसके बाद आप लाइए। तो अभी मजे की बात ये है कि हम लोग अगर देखें तो हैंड वॉशिंग डेटा तब भी अगर आप हैंड वॉशिंग फैसिलिटीज के मद्देनजर देखें तो इट लुक कमेंसुरेट, इट्स नॉट टू अ बैड। तो फर्स्ट थिंग इज दैट यू शुड हैव अ इंफ्रास्ट्रक्चर। अब इसमें एक डायमेंशन में और जोड़ता हूँ, इंफ्रास्ट्रक्चर है, बहुत सारे स्कूलों में है, ऑफिसेज में है, हेल्थ केयर फैसिलिटीज में है, हमारे घरों में भी है, लेकिन हम नहीं करते हैं हैंड वॉशिंग जिस समय करना चाहिए। कारण क्या है? तो स्टडीज ऐसा शो करती हैं कि अगर जब भी आपको हैंड वॉशिंग की नीड महसूस होती है, अगर आपके पास 10 या 15 मीटर के अंदर में एक हैंड वॉशिंग सिंक नहीं है, या प्रॉपर फैसिलिटी नहीं है, या बकेट एंड मग एंड सोप नहीं है, तो आप उसको अवॉइड कर जाएंगे। दिस इज अ ह्यूमन साइकोलॉजी प्योर। So then how to, I mean to say, create a simple availability of soap and water so that people can wash their hands in a dignified way wherever needed. So then there are now, technology is not a challenge. We have enough number of technologies and there are enough number of options that can help people in doing this. But the whole thing is that we have to decentralize hand washing facilities from one place to multiple places. Then comes the issue of, what you were talking about earlier about the linkage. So it's not a fight between wash and health and all that kind of a thing. Wash is a relatively, what Raman was saying, wash is a relatively newer acronym of water, sanitation and hygiene in the sector. But if you go in the history of water and sanitation, it was always called a public health engineering since British times. So it was always a part of the public health engineering part, which also I'm sure that medical fraternity has in creation of infrastructure like hospitals, primary health centers, and so on, and upkeep of it. So you have that engineering part in all the services, whether it is a water supply, sanitation, hygiene, or medical or healthcare as such. So this, sectoral kind of a debate that which sector it should be lying for a cross-cutting issue such as hand hygiene is, I think it's a business of all. Like our Honorable Prime Minister used to say, that sanitation is a business of all. So that the hand hygiene is also, I think, a business of all, and therefore need support and awareness and also efforts in that direction by all. तो ये दूसरा पार्ट जो होता है वो होता है आपका बिहेवियर चेंज प्रोग्राम में हम ट्रिगर्स और नजेस डिफरेंट टारगेट ग्रुप्स के लिए कैसे क्रिएट करें। ऑब्वियसली जैसे हम लोग बहुत ज्यादा प्रोएक्टिव होके कहते हैं कि बच्चों में आप बिहेवियर चेंज कीजिए और बड़ों का बिहेवियर चेंज हो जाएगा, ऐसा हम लोगों ने बहुत कम देखा है। कल्चर फ्लोज नॉर्मली फ्रॉम टॉप टू बॉटम। अगर आप एज ए पेरेंट हाथ धोते हैं क्रिटिकल टाइम्स में, तो आपके बच्चे भी धोते हैं, ये ज्यादा संभावना रहती है। तो जब ह्यूमन साइकोलॉजी की बात करें तो कल्चर ऑलवेज फ्लोज फ्रॉम टॉप टू बॉटम। सो वी हैव टू बी इन आवर सेंस create leaders who can run this message by their own actions at all the levels. How to do that? What is the communication strategy that can be? And so I think I'm not a very behavior change expert, but I'm pretty sure that our behavior change experts will be able to guide on this issue, that how to communicate with each of the stakeholders who needs to be influenced on this. And the third part, as I would say, is enabling environment. दो enabling environment जो बात होती है वो ये है कि हाथ धोने के लिए पहली जो चीज है, जो भी डेटा हमारे पास है, क्या वो रिलायबल साइंटिफिक क्लीन डेटा है? अगर नहीं है तो हमें रिसर्च में और भी इन्वेस्ट करना है। जो लोग हाथ धो रहे हैं क्या वो सेफली धो रहे हैं? आज ऐसे तरीके और रिसर्च मेथड्स अवेलेबल हैं जिनसे आप इस बात को सही बिल्कुल आप इसके बारे में रिसर्च कर सकते हैं कि कितने लोग और क्या स्टेटस है हमारा और हम कहाँ जाना चाहते हैं इस विषय पे और हम इसके पे कैसे जाएं। Invest on getting good data on safe hand washing, clean water, unclean water, soap, not available soap. All this comes later on. If you remember the sanitation program and try to see that what are the learnings were there in the first generation of sanitation program, we were saying to the villagers कि आप खुरपी लेके जाओ, गड्ढा खोदो, do your business, cover it up and come back. There was no infrastructure as such. That was what safe sanitation meant. Then came the toilets later on. And then that was a very basic toilet to start with. And then there was a sanitation ladder approach that once they are habituated to kind of safe sanitation, then they go on the ladder and then go to a better off toilet or whatever, when they learn the use of it and then they learn how to upkeep it and all that. The result is remarkable as of now. Can we learn something from sanitation and hygiene without getting too much into the debate of whether wherever people are living they have water? I can guarantee that. Clean or unclean is a question. And we have seen that about, in the pandemic times also, the service delivery institutions reported about 15 to 20% surge in water demand at the household level because of increased hand washing. So 15-20% of the overall uses was surged because of this pandemic, more hand washing and all that kind of thing, which is normal. But having said that, we have now the low water consumption devices that can help you actually in kind of putting up less water for hand hygiene. But the benefits are in comparison to that investment is many fold more. So obviously this messaging needs to be taken to the people, and the infection prevention part of it, the overall hygiene and hand hygiene as a subset within that is very important. What Dr. Majumdar pointed out in his address. This science has to be taken to the children for a sustainable behavior change right from the beginning in them, but not also that, but in Anganwadis also, in health centers also, and all these kind of facilities. So I think these three drivers of change would be able to accelerate our progress on hand hygiene from what we started or where we are as of now in 2023. But I'm sure that all the people's support and participation and voicing the importance of it and taking leadership at a personal level would be very important in that direction. Thank you.
All right. Thanks so much, Steve. Gaurav, let me come to you. The availability of facilities is critical. What kind of innovation is needed? Everything cannot be done by the government. Sarkar माई बाप है, पर सब कुछ तो सरकार नहीं करेगी. Even in the Swachh Bharat toilet building campaign, we did see private participation. Companies getting in from CSI. But again, the question was कि पानी नहीं था, टॉयलेट था, पानी नहीं था. अब इनोवेशन चाहिए हमें कि बारिश होती है, लोकलाइज तरीके से कैसे हम पानी को बचा सके और साफ कर सके ताकि हम यूज करें. What are you seeing? Is there an effort to bring in this innovation? Is something working at it? And behavior change needs specific kind of communication, and perhaps one size fits all won't work. But could you comment on what you're seeing? Are we seeing some kind of innovation coming? Gaurav, could you?
Yeah. Thank you. Thank you for giving me the opportunity to talk on this topic. I'm Gaurav, and I'm working in the health sector since a decade, and very much infant in the in the field of wash. So in front of this such eminent speakers, I'm going to share my thoughts, which is basically driven by my field experience. We have implemented wash related projects in 4 states. So, basically, my thoughts is, all my learning is from the field experience. So, even when I was listening Dr. Hira answer and the Sheila madam, I was thinking about the same thing. The best place, to start with is the school, because whatever the habits which we earned during our childhood period, we carry forward those learnings, in our whole life. And at the same point, the family, we have seen in the data of NFHS that the hand washing habits is better in urban area in comparison to rural area. So probably because of the family of urban people, urban are more, they are teaching their children to, wash their hands, following the hand hygiene habits. So the school, the family, the Anganwadi centers, these are the places where children are, where we can target the children is the best place. In a project where we were targeting the community structures like VHSSCs, like Jan Arogya Samiti members, and other community platforms. So, and directly community members. So we have seen that whenever we are going to them and we are talking about the healthy hygiene behaviors to them, and after a 1 or 2 meeting, when we revisit them, and we with behavioral nudges, we have developed many nudges, to talk with the community. But when we revisit to them, we found that everything is gone. So we have changed our plan, and we have a plan to visit the same community members in the same village 12 times in the period of 2 months, because we all know we have some research, and we that if a habit is follows for 21 days, there are high chances that we will follow these habits throughout the life, or for a long time. So with this thought, we have visited them, and we found a sustainable improvement in the healthy hygiene behaviors among the community. And definitely what Puneet sir said, that the behavioral nudges and is very important when we are dealing with the community, when we are dealing with the adults, because they are not they are driven by the knowledge, and they also require the habits. So knowledge induced habits can be a term which can for the adults, we can develop these habits of following healthy hygiene behaviors. That's all from my side. Thank you.
Right. Mr. Raman, we've got, the experiences of all the panelists with us. Now, the question of infrastructure or the lack of it, what kind of innovation is needed there? हम कैसे ये कर सकते हैं कि सबके पास पानी हो, साफ पानी हो, सब अपने हाथ धोने के लिए, क्योंकि बिहेवियरल चेंज टाइम लेगा, पर अगर आपके पास सुविधा होगी तो आप ज्यादा कोशिश करोगे. Any innovation that you are seeing on the ground, because in small pockets we see people building their own ponds in villages, conserving water, recycling water. क्या innovation चाहिए कि ये facility wise सबको ये सुविधा मिले?
Right. Thank you. That's an important question. But before I answer this question, we need to also see the audiences very specifically, because the innovations, when we say, it's a very generalized term, and each of the segment of the people would require different sets of innovations. and it would also will depend on. So that is one thing that I was talking about. Whether this habit of hand washing. Gaurav was saying that if it is 21 days continuum, then there is a definite possibility that people will continue it. And Puneet also was saying that some nudges and some issues were introduced. Then this habit could be. Infrastructure is definitely a driver to this habit, but not necessarily the what you call the non-negotiable. That is something that Puneet was saying in a different manner, that water is available everywhere. It's all about finding the ways to use. So what I would say is, for hospitals and health facilities, we need to require a different set of hand hygiene, which is part of the infection prevention and control. So that is one important set of things, because when we say that many of the issues from the hospital we are carrying now, whether it is a simple infection or it is a big bug, we are carrying, our health practitioners and health workers are carrying from the hospital to people, and those who visit hospital also get it. So that require a different set of infrastructure, different set of practice, and different set of protocol and assessment, and then establishing that practices within the job profile and definition, and then continuous monitoring and establishment of that practice within. So that require one set of infrastructure. The second set of infrastructure would be required for the other kinds of institutions, like schools, like Anganwadis, like creche for children. So these all would require a different set of infrastructure compared to the hospitals. The third set of infrastructure, of course, officers and those kinds of institutions will also come there. The third set of infrastructure will be for those traveling community, wherein the stops in between roads and food junctions and those kinds of places, bus stops, railway stations, and so on and so forth. There are several set of requirements there. And the fourth set is at the household level for individuals. That also will require change. There's a huge variation of housing arrangements that our people are living in. So from the well-to-do houses to the homeless community. So people are living in different sets of living conditions. So we need to look at, when we are talking about infrastructure, what is the better option for each of them? But we need to also take in account of the aspirations of the community. That is where I was talking about the market. So when we are talking about nudges, I'm not a behavior change expert, but my domain is policy and policy analysis. So I'm looking at behavioral change policies, from that perspective. So what I largely see is that, the aspiration to infrastructure is always for the advanced, set of things. So even if you give a moderate or, ordinary set of infrastructure for, in health services, since Dr. Hiralal is here and Dr. Majumdar is here, both of them are stalwarts of health, practice and health administration. So they can speak more about this. But I would say is, in the health for the poor, that is one argument that we used to have. Health for the health services for the poor cannot be poor health services. Similarly, the infrastructure for poor, whether it is for hand washing, that cannot be poor infrastructure. So how we can ensure that is where, your point, Anisha, when you were saying about everything cannot be expected from the government, we need to see that some of the public health goals, when it is a population health goal, hygiene is one. Hygiene is a population health goal. Unless everyone in the society is able to practice this, we may not be able to achieve what we are trying to achieve. So this is where the government has to, and government has to, and governments have to come in, whether it is a local government, whether it is a district government, whether it is provincial government or a national government or even international agencies. So this is where we need to look at how, the gaps within the infrastructure, what are those gaps, and how to make acceptable infrastructure, not only, stopgap infrastructure. That is where, whenever we are talking about poor, we think stopgap infrastructure will do. The sanitation, experience suggests that the aspiration for those working class, whether the domestic workers, whether the other kinds of societal people, their aspirations were from the exposure that they had. So I'll take an example of Kerala, from where I'm coming. So Kerala state has adopted the infrastructure in a much better manner, because they have exposure to entire global countries, advanced global settings, whether it is Europe, whether it is US, Canada, or even the UAE and the Arab countries, wherein they have imitated many of the infrastructural things there. So the imitation and the aspiration has the market also creates, when we say clean water, not necessarily the pure bacteria free or the kind of chemical, not chemical free, even water is a chemical. So the added chemical free, kind of water is not what people will think. They will think about the market driven value, wherein the bottling, packaging, those kinds of things falsely represent sometimes the value of it. So the aspiration becomes sometimes or many times to a wrong object rather than the right object. So we need to also understand the nuances of the communication when we are talking about infrastructure in this process. So finally, this infrastructure, we need to understand various audiences, what is acceptable and what is scientific for them. Both, we need to meet both, things. Not only if a scientific infrastructure is introduced without having people's acceptance, they are not going to use it. So we need to build that acceptance also. It's not only about nudging. It is also about, making the universality. So that what I am getting, even if I am a slum dweller, homeless, or a domestic servant, or a sanitation worker, what I am getting to be, if the so one other example, again, time is a limitation, I know, I will not go to the example, but it is very important that we have this comparability. So if we can get something scientific and acceptable across, that is the innovational, the basis of the innovation that I would suggest. In that sense, if you say there are several stopgap arrangements that the COVID has introduced, and the UNICEF has interestingly compiled a very, very important set of hand hygiene innovations that was introduced by and Puneet. I know that he was one of the innovation was developed by him, while the auto rickshaw drivers, how they can use a very simple device for carrying water within the limited space available, and use it while traveling. So there are several such innovations that has come, but we need to do an analysis of what is the utility of that innovation, what is the acceptability of that innovation, and how scientific it is. If we are able to do that, then it will be able to universalize it. I'll stop there. Thank you.
All right. Thank you so much, Mr. Raman. We're running short on time. So, Dr. Mazumdar, what would be your suggestions for getting the behavioral change? Innovation for better infrastructure, what the government can do, all those things are already underway. How do we change behavior? Because we are doing this as a reminder to everyone that you must wash your hands. What more can be done when it comes to messaging? And does one size fit all? I request you to unmute yourself, Dr. Mazumdar.
This time is very short. So instead of, talking about it, I'll just give an example of a project that we are doing in Bhilwara district of Rajasthan. Now, it was mentioned by several speakers that the schools are very good focal points. So we are working there in a village on 11 schools. What we are doing is to provide drinking water, sanitation facilities, MHM, a health room for very primary basic health parameters. And at the same time, go on creating awareness. So almost every day, there are interactive lectures with the students from middle school level to high school level. And I'd like to say here that the students are keenly interested in this. And parallelly, the teachers and the principals are also involved. So there is a holistic approach in this. Plus, we do have focus group discussion and community interactions with the community. So schools are the focal point, but in a greater circle, the villagers are also involved. So this is one very important way of doing or influencing the people. Another issue I'll just put in here. I mean, this is not the question that you asked me, but just my observation. It's about, you see, the government is doing its best to bring in FTCH and so on. What we as people or as groups or institutions and academies, what we can do is to see how we can minimize wastage of water and maximize harvesting of water. So these are small things which the communities can do without the help of the government, or even individual families could do. So rainwater harvesting, having systems which comparatively require less water. You see, in the market, all kinds of things are available. So if we consciously take a decision to use implements which less water, then more water would be available for other things, including hand wash. Thank you.
All right. Puneet, I'll give you the last word. What are your tricks and tips to get the message across? And will it have to be different for urban audiences versus rural audience? Children versus adults? How do you get better messaging and awareness about hand washing going?
Thank you. I just would like to say what I already mentioned, that we need to have a different kind of communication strategy with different kind of stakeholders, making it, I meant to say, more engaging with them on this issue of behavior change towards safe hand washing. So I would not say this or that, but I'm aware of the diversity in the country, and also the diversity of the stakeholders as such, and the cultural practices, and the kind of, somebody mentioned acceptance is vital besides science behind it. So I think, yeah, some of these things becomes very critical when you are looking at adopting appropriate behavior change strategy at the local level, and then for different category of the stakeholders and age groups as such overall. So I would just stop here and say that I think involving everyone through a right kind of a behavior change strategy is very, very important to accelerate this progress on the hand hygiene.
Right. शीला मैम, आपका क्या एक्सपीरियंस है? आपको लगता है बच्चे अपने बड़ों को सिखा सकते हैं कि हाथ धोना जरूरी है? मैम, अपने आप का म्यूट कर देंगे प्लीज? अनफॉर्चुनेटली शीला मैम, हम आपको सुन नहीं पा रहे हैं. I'm so sorry about this. डॉक्टर हीरालाल, आपने हमें एग्जाम्पल दिया कि योगा के माध्यम से आपने हेल्थ केयर प्रैक्टिशनर्स को सिखाया कि हाथ धोने जरूरी है, वो अपने घर में भी कर रहे हैं. और कैसे हम ये मैसेज सबको बता सकते हैं कि हाथ धोना जरूरी है और ठीक टाइम पे जरूर होना चाहिए?
देखिए, फैमिली इज द लोएस्ट एंड स्मॉलेस्ट ऑर्गेनाइजेशन, जिसको हम मानते नहीं है. हम ऑर्गेनाइजेशन जो, ये फैमिली हमारी एक ऑर्गेनाइजेशन के रूप में, जो मैंने कहा ना कि वो बच्चे को आप सिखा दीजिए और बच्चे के दिमाग में ये डाल दीजिए कि घर में जाना तो अपने पापा मम्मी चाचा ताऊ सबको टोकना. अगर वो बच्चा ये, और बच्चे, देखिए बच्चे का जो बिहेवियर है, इट इज नॉट स्टेबलाइज. ये बुढ़ा है, नौजवान है, उसका बिहेवियर स्टेबलाइज हो गया है. कितना भी हथौड़ा मारोगे बिहेवियर चेंज नहीं होगा, लेकिन बच्चे का बिहेवियर चेंजिंग बिहेवियर है और हमें ये चेंजिंग बिहेवियर की जरूरत है. इसीलिए बच्चा हमारे लिए सबसे बड़ा कैच है. अगर बच्चा गया, जैसे हम लोग बच्चों को देखते हैं अपने घर में, कोई सिगरेट पीता है तो वो सिगरेट पीने लगता है, जो बच्चा बहुत ऑब्जर्व करता है. अगर आप स्कूल में उसे सिखा दीजिए, कहीं अपने घर वालों को जाके टोको, बताओ कि हमारे स्कूल में ये सिखाया गया, पापा तो हाथ गलत धो रहे हैं, तो वो पापा भी शर्मा के बहुत जल्दी से उस बच्चे को चेंज. लोगों का ये जो मानना है कि बच्चे की वजह से बाप और घर वाले नहीं मानेंगे, मेरा तो मानना 100% मानेंगे और जल्दी मानेंगे, क्योंकि बच्चे के उससे जो है थोड़ा शर्म भी आएगी कि अच्छा बच्चा हमारा ग्रो कर रहा है. उनको अच्छा भी लगेगा कि देखिए बच्चा हमारा इतना अच्छा हो गया कि हैंड वॉशिंग मुझे सिखा रहा है. तो देखिए, अगर कुछ चीज इसी तरह से ऑफिशियल्स में, अगर हम ऑफिसेज में ये हैबिट को कल्टीवेट कर दें, साबुन रखवा दें, तौलिया रखवा दें और मॉनिटर, ये काम मैंने किया है कहाँ, बांदा में. तो मेरा तो अनुभव यही है। हम लोग 80 ऑफिस थे, वहाँ हमने पानी बचाना उनको सिखा दिया। तो जब उन्हें वहाँ पानी बचाना सिखा दिया तो अपने घर के हाउस में भी पानी बचाने लगे, हर जगह वो प्रचार करने लगे। तो अगर मैं एक चीज कहता हूँ कि अगर टीच द टीचर्स, अगर किसी स्कूल की इफिशियंसी इम्पैक्ट को बढ़ाना है तो आई डू नॉट फोकस ऑन द स्टूडेंट, आई फोकस ऑन द टीचर्स। टीच द टीचर्स बेस्ड ऑन दिस प्रिंसिपल आई एम सेइंग इन एवरी ऑफिस, इन एवरी स्कूल, क्रिएट मास्टर ट्रेनर फॉर द हैंड वॉशिंग थिंग्स। उसके बाद ये अगर जो आदमी ऑफिस में हाथ धुलेगा ना, अपने घर में भी जा करके वो प्रचार करेगा। और इनको कंट्रोल करना, इनको चेंज करना आसान होता है। अदरवाइज एक जिले की 20 लाख आबादी होती है तो ये चेन बनाना पड़ेगा, इंट्री पॉइंट बनाना पड़ेगा। हमने तो योगा में यही किया। नॉट ओनली दैट, ये पुनीत उसके उदाहरण पानी में यही किया। हमने पानी में पहले ऑफिस में पानी बचाया, क्या टीचरों से बचवाया, उसके बाद वो पूरे वो जहां जहां जाते थे वो एक माहौल बन गया। इनेबलिंग एटमॉस्फेयर क्रिएट करना है। एक पॉइंट और मैं बात करूंगा। जैसे मैंने ये कहा ना, सोप नहीं है, पानी नहीं है, छोड़िए जिसके पास नहीं है, जिसके पास है पहले उनकी स्टडी करिए। मैं तो कहूंगा ये जो यहाँ लोग हैं कि जिसके पास पानी और सोप एवरीथिंग अवेलेबल, उनकी तो देखिए क्या हाल है। कोई भी आदमी प्रेस्क्राइब्ड तरीके से हाउ एंड व्हेन, कब कब धुलना चाहिए और कैसे कैसे धुलना चाहिए, जिसके पास साबुन है और पानी है वो नहीं कर रहे हैं। इस पर स्टडी करके पहले जिसके पास है उन्हीं को ठीक कर लो भैया। एक बार वो ठीक हो जाएंगे ना तो एक इनेबलिंग यहाँ भेड़ चाल है। एक बार वो इनेबलिंग माहौल इससे बन जाएगा तो जो नहीं है वो अपने खाने से कटौती करके धोना शुरू कर देंगे। तो ये मेरा यही जो है वर्जन है कि जो है उनको पहले ठीक करो, जो इनेबल है। देन ये इनेबल एटमॉस्फेयर विल बी क्रिएटेड फॉर hand washing to have the required hand washing hygiene. Thank you.
All right. Thank you all for joining us for this first session. Dr. Hiralal, Dr. Mazumdar, Mr. Raman, Mr. Puneet, Sheila ma'am, Gaurav, thank you all for joining us on this session to discuss the impediments that come in the way of promoting hand hygiene and sustainable behavioral change.